All right, welcome to Health Professions Week. I'm talking about public health here, so thank you again for joining us. Do a quick review of what we're going to talk about tonight. So I'm going to go around and we'll do some introductions, and then we'll talk about resources for exploring public health. Then the big part is the panel discussion, so you can learn about everybody's path to public health, and we'll have an open Q&A. But even though it's listed here at the end, if you have any questions along the way, feel free to drop them in the chat. We'll keep an eye out for that and ask them along the way. All right, so I'm your moderator for this evening. My name is Tracy Stewart. I'm the Senior Director for Outreach and Recruitment at the Association of Schools and Programs of Public Health. And I'm joined here by 5 awesome panelists who are our This is Public Health ambassadors. So we have Grace Hall, who is an MPH candidate in Community Health Science from Baylor University. We've got Inara Rajwani, an MPH candidate in Behavioral, Social, and Health Education Sciences from Emory University. We have Vishwa Patel, an MPH candidate in Epidemiology from Drexel University. We have Arpana Kirky, an MHA candidate from East Tennessee State University, and Haley Pucker, who is an MPH candidate in epidemiology from Colorado State University. So I wanted to get started and just say, what is public health? So a great definition that I like to use is public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. So we like to think about this as instead of a doctor or a nurse who works with patients individually and usually treating disease, public health is working at the community level generally, trying to prevent them from getting the disease in the first place. There's a lot of systems thinking, data analysis, there's a lot of social sciences, psychology, behavior, a lot of different areas that go into the promotion of public health and helping everybody live longer and healthier lives. So why is this group here presenting this? Like I said, I'm with the Association of Schools and Programs in Public Health, and our vision is improved health and well-being for everyone, everywhere. We do that through our mission, which is advancing academic public health by mobilizing the collective power of our members to drive excellence and innovation in education, research, and practice. So long story short, we represent colleges and universities who are accredited by CIPH, which is the Council for Education and Public Health. And so our members are all over the world. So the students who are here today are all students at these accredited institutions. So now I want to talk about a few resources. If you're thinking about public health, we offer a lot of opportunities to learn about and engage in public health. So we do that through 3 main brands. One is This is Public Health. This is Public Health is our awareness building brand. So you're going to find a lot of activities that that help you understand and connect to public health through that. I'll talk about some momentarily. Then we have SOFIS, which is our application. So sort of like the Common App when you're going into undergrad, it's a centralized application system so you can apply in one place to multiple institutions for grad school. And then finally, we have Public Health Jobs, which is so you can explore careers. It's a free website for you to search on and for employers to post on. So especially when you're early in your career or still a student in high school or college, this allows you to kind of see what's out there in public health and see if there's patterns, jobs that sound interesting to you, because that can help shape what you want to study in undergrad and grad school. One way to connect is to be social with us. We're on Instagram, Facebook, and Twitter. The first 2, you can find us at This is Public Health, and on Twitter, we're at TIPH Tweets. The reason it's great to connect with us on social is that we're really telling the stories about what is happening, what's going on in public health, what students are passionate about. Our ambassadors that are here tonight take over our social media, and they talk about all the things that they care about and areas of public health that are of interest to them. So this is just a quick snapshot of some of the recent posts. So, we had somebody talking about health literacy and communicable diseases, World Polio Day. I don't think this was any of your takeover, was it, on the panel tonight? Okay. So yeah, so you should follow that and just see what all topics are out there. You'll never know what might be inspiring for you. So we also have a lot of events to help you explore public health. So we have topical webinars about public health. So we did one on One Health a few months ago, for example, or climate change. We've had webinars on that. We do career spotlights that talk to different employers. So we talked about the uniformed services. We've talked about just different governmental public health jobs. So you can really learn about what kinds of careers are out there. We have pathway webinars. So if you go to this YouTube playlist, you'll see different interviews like this where you can hear people's stories about how they chose public health. And there's university events. So we always highlight our member events because they are always having open houses or just different ways to connect. And finally, I wanted to highlight our book club. Our ambassadors actually lead that, and they talk about one book a quarter. You can learn about a different area of public health, and then they have an engaging discussion, either online or sometimes they've done interviews with the author, or just different things. So that's on Goodreads. This is Public Health Book Club on Goodreads. If you decide that public health is the path for you, when you're ready to go to grad school, you want to check out the academic program finder. So this is linked through our different websites, aspiph.org. This is Public Health and SOFIS. You can get to it, and it allows you to search by area of study, or if you want a degree online or in person. Really popular now is you can search and see which degrees require the GRE or do not. So all these different areas you can search for. So it's a really robust and useful tool in finding the right fit for you. Once you find that, you are able to talk to the schools and programs through our different grad fairs that we offer. So we have, this is public health grad fairs in person. We're back in person this year for the first time in 3 years, which is fantastic. We offer a few of those each fall, and then we have virtual fairs that happen usually in the fall, but we do have a couple that happen in the spring. Those come in two different formats. One's like a chat room where you can just go in and ask your questions of the admissions officers. And then another one, we have a setup where you can hear a presentation first from a handful of schools and then go into breakouts and talk with different admissions officers about their institutions. So unless there's any questions about those things that I've just covered, I'm going to stop sharing my screen and go into the panel question and answer. Okay, so let's see, stop share. All right, so my first question for the panelists is, can you tell me when and how you became interested in public health?
I can start. I think senior year of my undergraduate spring semester, I took a interdisciplinary class called community interventions and advanced care planning. And to really cut it short, we were every Monday, Wednesday, Friday at 8 a.m. we were talking about death and dying. And it was a very morbid thought to have as a 21, 22-year-old. Why am I talking about death and dying? And kind of looking at what kind of quality of life are people living, and the decisions that people make that would it be based on their quality of life. And that kind of is very interesting because it was taught by a social work professor, and I was there as a biology major. We had math, statistics, so many random and it was an 8-person class. You had to apply to get in. And it was such a unique and diverse experience. And it kind of made me realize that the quality of life that people live really impacts the decisions that they make in life, especially over living and dying, in terms of how they do their advanced directives. And I realized that I wanted to be a person that helps improve like a person's overall quality of life rather than like a disease or a small aspect. So that was like in just like why I became interested in public health. It started off very morbid, but it's come a very long way since.
Love that.
I can jump in next. I took an intro public health class my last semester of my last year of my microbiology degree. And I was like, oh, shoot, this is really cool. Maybe I messed up with my life. Then right from undergrad, though, I went into professional fundraising for nonprofit organizations. So totally different career path. I thought maybe I would be happy doing that the rest of my life, but then COVID happened, and I'm a person who's very empathetic and very into social justice. And I watched as marginalized and oppressed communities, took the brunt of most of the COVID fatalities. And I was like, okay, there's more I can do. And then I remembered back to that public health class I took, started looking at public health grad programs. And I was like, okay, yeah, this is it. This is it. And that's what brought me into public health. And there's not been a single day in the last year and a half that I've regretted that decision.
I can go next. My tradition of a journey of public health was kind of untraditional. I originally thought I was going to attend medical school right after undergrad, but then COVID happened. And during COVID, I was actually like an intern and volunteering at various different hospitals during that time. And I would literally see patients who have chronic conditions and chronic diseases choose between their well-being and their financial well-being. So that really hit home, especially coming from like an immigrant household and having a parent who also has a chronic disease. So I thought in order to make a difference was to start the root of the foundation, which was public health. So basically like that's why I decided to get my MPH and maybe start like more of a clinical conversation through preventing illness, promoting population health, and reducing inequalities in health.
I can jump in next. Mine is a little untraditional as well. I was previously a bio pre-med major, starting out freshman year, and then sophomore year, spring semester, which I think is 2020 is when I switched, or 2019 when I switched. I was meeting with a professor just for fun to kind of sit down and have coffee. And she was talking to me about her research in equine health and autistic disorders, and how she's doing research with them. And she got talking to me about public health and the really cool programs we have here at Baylor. And I left that meeting and said, I need to switch my major. I'm gonna enjoy it a lot more over here in the public health field than in the bio field, where we were focusing on treating the patient when they walked in instead of trying to prevent disease on the forehand before they get to the doctors.
I guess I'm the last one. So mine is very South Asian kind of story where my brother is doing residency in Ohio, but when I was back in Nepal, my parents expected me to do medicine as well. And after high school, I was not sure. I'm one of those people who was never sure what I want to do with my life. And I knew I was interested in biology and health, and I did good in all those subjects, but I still was not sure what route I want to go. And I was just looking into something that would help me be around the health, but not specific to clinical rotation and dealing with just individual. So I looked into the internet and I found out about public health, and we only had 3 universities in Nepal. And I already missed the deadline to take an exam, entrance exam and everything. So I thought US would be a good option for me because there is a lot more exposure, and the university here have more research than in Nepal. So I just told my parents that I'm doing public health, but I'm also living in Nepal, and that's just the history. And then I've been living in the United States for 8 years now.
Amazing. I have to say that's one of my favorite questions to ask anybody in public health, because everybody's path to public health is so different, and you also really get so passionate. It's always so exciting just to hear about the different areas that people are passionate about. It's all so important. So that's how you got here. I want to talk now about where you hope to go. So broadly speaking, I know careers are long and they change quite frequently, but as of now, what's your career aspiration? What are you trying to do with your degree?
I can go first on this one because it's something I'm really excited about. I am going to be starting my PhD in infectious disease epidemiology in the fall. I am going to be working with primarily animal disease, which does have a huge impact on humans when there's, either zoonoses or if it's just disease that can decimate like a livestock population that has an economic impact on people. Long term, the dream goal is to work for the World Animal Health Organization, which is sort of the animal equivalent of, the World Health Organization. So I have fallen in love with epidemiology. I started my program as a One Health concentration and then added on a second concentration in epi just because the classes have been so much fun for me. And it's still fun saying that and a little weird because when I was younger, I was not a math person. And I find myself now being like, I love math. Like I could do algebra all day. It's very bizarre.
As I mentioned earlier, I did want to go to medical school before my public health degree. I still plan on going to medical school. So currently that is what I'm striving to do. When it comes to a particular physician, I love so many different areas of the human body. So it's kind of like up to me when I get to that point in my life when I'm doing rotations. But I think the main goal is I want to be as best caregiver or caretaker as I can to my patients. And that's why I'm going to using my MPH background in order to implement with my medical degree.
I can go next. This past summer, I was working with a local nonprofit for my practicum, and I really saw that there was a need for health attorneys. So I am now doing a quick 180 and studying for the LSAT and looking at applications up and down the Eastern corridor. But I'm going to do that and working towards health policy law.
I can go next. So with my MHA degree, I aspire to work more on leadership side of public health. And that was my dream since I thought about public health, to work for one of the UN organization and developing country, since I come from one of those and I know how it is and what changes we can make. But for now, I'm also looking for the rural health in nearby, because I'm studying in Tennessee, and there is a lot of opportunity in here that serves underinsured and uninsured people, and that's my target population.
All right. So that leaves me. So one of the things that I'm really passionate about is maternal and child health and sexual and reproductive justice. I think it's a very underspoken field. I'm very passionate about it. I can speak about it for hours. So long term, just like knowing like in the South Asian community, it is not something that is talked about. I remember when I was in high school and I went through health class, I did not learn any of the important things that I should have learned. It wasn't until college where I even learned the definition of consent and why is that important, and why every individual has to have a say in their care and everything. So long term, that is something I hope to do. It is a minor that I get to take here at Drexel, so a lot of my classes are geared towards that. And a big thing about how I hope my career pans out, kind of how we focus in public health, as we start at an individual level, work at a community level, and then a population level. So I want to do work that focuses on community and city level, and then eventually work my way up where I'm focusing on big and large populations. So Aparna said about the UN, that's always been a dream. So doing something with the UN that relates to maternal and child health, focusing in America, because so many disparities still exist when we look at maternal mortality and infant mortality, focusing in the US, but also globally, because there's a need for that everywhere.
I love it. All such important areas. It is amazing whenever you're talking about public health, you're like, yeah, we do need to fix that. Yeah, let's fix that. So it's great that you all are tackling all these different issues. I know one question I get a lot, especially from older high school students or younger college students, is what do I need to study to go into public health? And um, public health is interdisciplinary, and we need everybody, and we need all different kinds of viewpoints and backgrounds to really make a difference. So there is a public health major as an undergrad, and that is awesome. But I'm guessing you all don't have a public health undergrad from your background. So could you tell me what you did study and how you think that's helped you in your degree?
I can go first. I mean, I did my bachelor's in public health from Texas A&M, but I also did minor in business because while I was in second year of my public health, I realized that I'm more into administration side of public health. So I just went for it and I finished my undergrad in 2020.
I can go next. So in terms of undergrad, I was like a very typical biology, like thinking about like pre-med, pre-PA, like something in the healthcare realm, until I got to like that interdisciplinary class I took. And that was because I took biomedical ethics and I really like enjoy ethics. I think there's so many opinions and like how I think it's a way to converse without like offending people, and kind of showing like different viewpoints and being able to learn from them. So I had the chance to take biomedical ethics it was like we had to take like a philosophy class as part of our liberal arts education. So I got a chance to take that, and then like the professor who was doing our interdisciplinary course, like she like told like our professor about it, and it was really fun. Like all the 8 people that were in the class were like someone that I had met throughout my 4 years of undergrad. So it was someone that I've already previously connected with or had a class with. So definitely very interesting. But I started off with biology. I would mention that like one of the classes that, or I guess like a field of classes that I would wish I would have taken would have been like sociology and anthropology. Like I did take medical anthropology, but like there is like other classes that I feel like that should have like would have like prepared me a little bit more to like what I did learn about my first year. And I always found them very interesting when I heard about it from my friends who were taking those classes. But yeah.
So I originally studied microbiology, which was all great and fun. And I got published from that, and that was all great. And then I worked for a few years. And then I went back to school and I studied community engagement and education. And I can say, with all honesty, that prepared me better for public health than microbiology ever could. It was really important because a lot of the coursework was about community development, how to work with communities, especially communities different from your own. And it was really cool to see how, when I started becoming interested in public health again, how there was really great overlap there, because there was a problem in a while with a lot of research, not just public health research, where, researchers would want to study populations different from their own. They'd go into a community, say, hey, I'm the expert, let's go. And people wouldn't want to work with them because they didn't get to, do the work to know the community. And through the community engagement and education coursework, I really learned the importance of getting to know and build trust with communities different from your own. And it's something now that I see a lot more in public health literature. Like you'll see the words asset-based community development pop up a lot. And that all comes from like community organizing work. And it's really exciting because I'm TAing a Foundations of Public Health class this semester. And I got to do a whole lecture on community organizing and development. And it was really fun because the students really got to see the value in it. And, like you said, like with the sociology, these courses on how to work with humans, I think is so much more essential, even than, not that, some of the biology isn't important, but I feel like knowing and understanding how humans work is so much more important than any of that could ever be if we want to like successfully help people.
I can go next. So I am in a little bit of a different situation. I am in a 5-year joint program. So I am still currently getting my undergraduate degree alongside of my master's degree. and I'm getting my undergraduate, or I should say finishing, I only have one more class, but my undergraduate degree will be in public health. It has been the majority of my undergraduate time here. I did my first freshman year do bio pre-med and then did make that switch. So I have all of those super fun science classes and OChem classes right alongside public health, talking about community and global disease. So studying really hard for OChem, but then also being able to turn around and then talk about community organization or community-based participatory research. So lots of fun.
I was kind of on the pre-med track in undergrad, so I did biology as my major and concentrated in biomedical sciences, but I minored in chemistry and psychology. And that psychology aspect is where I kind of like learned more like behavioral science and like how that affects like social determinants of health in like individuals in different populations. So that kind of also kind of was a derivative of like why I should get an MPH program. And I kind of a little bit thought of like, should I get like a dual degree in public health possibly? But I really wanted to graduate and I didn't want to extend like another year. So I ended up getting my master's and I absolutely love it. And now I look back at it and it's like, it's a very inclusive like degree that, and it's also like anyone from any background can join. You don't need a public health bachelor's in order to get a master's of public health. It is very doable to do that 180. And I've seen many students in my cohort do it as well.
You surprised me with a couple of public health majors, but that's great. And but you can see you don't have to have that, but it's a great bonus if you do. So let's also stick in the undergrad realm and talk about extracurricular activities. I get the question from students a lot of, how do I get experience in public health? And a lot of my answer is in your extracurriculars. So I don't know if you all went out with an idea of an extracurricular you worked on that might be public health related, or if you didn't realize it at the time, but looking back, you're like, oh, that was public health. So I just wanted to hear what kind of extracurriculars you were involved in, but also if it's not related to public health and it's just fun, like let's share that too.
I can start. So I was part of our like undergrad student government. So I was a member of the executive board, and I was like the coordinator for like our after dark committee. So we planned like late night programming events on campus. One of the things that our very small school did is that we had school dances, and that was like a way to like offset. And another thing about the school is that that's a dry campus. So another thing, we had those dances as a way to like offset like the binge drinking that would happen off campus, like in houses, like anything, and like kind of have it in a more controlled environment, like give them a controlled environment where if something does go wrong, like there are like EMTs or like professionals like security there that would like be able to get them like ready help as needed. And like students wouldn't need to like be like, hey, like I would be like the good Samaritan role that a lot of schools have, like wouldn't get in trouble. Like there isn't like that consciousness that they're thinking about, should I do it, should I call, should I not? Hopefully people do call. So I did that like for like it, like I worked my way up till like my junior year, and then I was the coordinator, and then my senior year I got the opportunity to be like a peer educator for our wellness center. So 3 years of working these dances, and as coordinator, like my junior year I would have to kind of be there like the entire time. So like from 7 to like 1 a.m. like when cleanup was done, like I would be there just watching over, making sure like nothing happened with like other officers and everything. So for me, like I felt like that was like a very public health thing, because every like conversation we would have with our executive team, with like administration, we're like, we need to get these numbers down, like we need to create like a safe space. And a lot of like during that time, the Me Too campaign was like very like prevalent. It still is, but very prevalent in the country. And like we were hearing about it to make sure that like sexual assault and like people were safe, like it was a safe environment that we were creating, and alcohol was not like influencing like how or like people's decision making and all that. So the following year I got to be a peer educator, which was like we're promoting awareness of like healthy lifestyles. So like we would have like awareness weeks, so like alcohol and substance use, physical and sexual health, like mental health. So all of those things, I feel like my 3 years of being in student government like really prepared me to be like a peer educator. And I guess like looking back, I didn't think about it then, but looking back on it now, it was something definitely very like public health oriented, looking at like the community of the school environment and seeing like what we can do to like better and like promote like their overall health and like safe healthy practices.
So my experience is funny. Like one thing was very intentional as being public health, and that was I volunteered at a shelter for unhoused people that was doing like COVID screening. And then, you know, if people tested positive for COVID, helping them find the resources for that. That was very intentional public health. Two of the other extracurriculars that I served on, I didn't go in thinking there was a public health matter. I just thought these are important things. One of them was our Women and Gender Resource Center had women and gender advocates. And I did that, which was really cool because it was just one of those things where I'm like, I'm a woman. I find, you know, women's health to be important. I find, you know, health of non-binary and trans folks to be important. And this is a really cool way to learn more about this and how to advocate for myself and for others. And so that, you know, and then looking back on it, it was like, oh, that was public health. You know, that wasn't just, you know, women and trans rights, like that was public health. And the other opportunity I got to participate in was there were several, I did my undergraduate degree at the University of Wisconsin-Milwaukee, and they had several different groups that were like president's council for different issues on campus. And I served on the one that was the President's Council for Mental Health. And that was looking at the practices on campus that had to do with, you know, mental health, whether that was awareness, how we handle, you know, students who are having mental health crises, like what's the appropriate way to go about this? Is the university going about this the appropriate way? And that was just something that I was also passionate about because I'm, you know, one of the millions of Americans living with a mental illness. And I thought this gives me a great opportunity to provide how I've been treated at school with mental illness and, you know, reflect on that and help others. And looking back, I was like, oh yes, that was very public health. I just didn't realize it at the time.
I would say like so when I came to US, it was like a blank page because I didn't know how it is there. I came here by myself. I would look for all the opportunity out there. I would ask to the professors. I would go to health department in the school and then talk to them and see. So fortunately, they did have this opportunity, and they were also called peer educator, where we would be working on two different health issues like sexual health, nutrition, sleep. And it depends on what group you're in, and you'll be like we would present in the class, we'll do the tabling, and also we talk a lot about good Samaritan. But I moved to Texas after 2 years, and my school was 1.5 hours drive, so I didn't get much time to be engaged in school. But I did, so I did research and I found out that SAMHSA was nearby my house, and I continued my volunteer with American Red Cross and did a pillowcase presenting, disaster management training. And after that, I just worked as a behavioral therapist. That is not exactly what public health do, but I realized that that's not what I'm interested in. But I did appreciate what they are doing for the population that are dealing with autism spectrum. So I did do everything of here and there, and then I realized that what I want to do with my degree.
I can go next. Sorry. Kind of going off of that, I am a student athlete, so time is very limited and also spread very thin across only those 7 days of the week. So what I found myself doing was working with professors in my department when they would put on health fairs. Waco has a very high transient and low income population, which is surprising because we have Chip and Joe from Magnolia and HGTV. But we do have a very high population of low income and transient. So what we would do is there's this thing called Church Under the Bridge, which is church held on Sundays under I-35, which is a huge interstate that cuts across Texas. And 1 or 2 Sundays every semester, we would go and host this big health fair where we would talk about dental care, proper hygiene. We would hand out clothes and stuff for people of all ages. So if you were a single man or if you were a family coming with 5 children, we would just come together and teach you, educate, but also make connections with those in the community and make sure they're not feeling alone, and really kind of talking to them and making sure they're seen and heard, and also giving out resources and making sure they can get to the right area within the community, because sometimes they're not as well advertised in this area when we have such a high tourist attraction too. So making sure they're still supported and also feeling welcome where they live.
For me, it was very clinical based. But I worked in a hospital, so I worked at Johns Hopkins All Children's Hospital, and I volunteered there, as well as I did an internship at Vanderbilt University as well, which I delivered medical supplies to hospitals like in the Middle East, or like in third world countries. And with other extracurriculars that I did in undergrad, I was also a peer coach. So I was kind of like a security blanket for students that would come to me if they needed like a friend, or if they needed like resources or a person to get advice from throughout the university, as well as I was also an ambassador at my university in undergrad as well. But when it comes to public health, I guess like the activities that I was doing, and I guess the effect and the outcome that I was delivering was public health. Like I was helping so many communities that were in distress and had many disparities. And at the end of it, I guess like I saw the way that like how medicine and clinical environment can connect to public health. So even though like my actions were more clinical, the outcome was more public health oriented.
So interesting, and it makes me want to go back to undergrad and do all kinds of activities. Thank you for that. So so now you're in grad school, and I just wanted to hear a little bit about what your experience is like as a graduate student in public health, and if you want to share that, would be great.
I love grad school and I never want it to end. I am having an amazing experience, and it's just, I can't believe the 2 years are almost done. I'm sure everybody can kind of like agree, like it goes by way too quickly. The opportunities have been absolutely amazing. I became the vice president of our student council here the first year. This year, I'm our student council president. This is public health ambassador, which was like such a huge honor because it was something I followed on Instagram as soon as I got into public health. It's been so much fun. It's work. It's a lot of work. I won't lie, like there's still like the stress of studying and getting things done, but it's so wonderful to wake up every single day and realize that I did the right thing, like the career change, the school. Like I am so happy with where I ended up, just because the teaching staff has been amazing. The mountains in the background aren't a bad thing either. It's just been so cool. But again, it's work, just like undergrad, you have to study, you have homework to do, but it's really cool to be doing something that you're even more passionate about. I think, undergrad, you have to take a few courses that maybe you're not as excited about. And I feel like in grad school, almost everything is so exciting because it's so applicable to what you want to do. And even the things like, I'm now TAing the foundations course, which my first year I was like, oh, this is going to be boring. Like it's just an introductory course. Ended up being one of my favorite courses, just because we got to talk about social determinants of health. We got to talk about community building. Like it went way deeper than I thought a foundations course would. And that's how everything is. It's been a really, really wonderful experience for me so far.
You did an amazing job summing it up. I'll try to add something different. I would kind of reiterate that it's tough. but it's extremely rewarding. Like you get to go to class every day with someone who shares the same passion or even the same discipline interest, whether it's mental and child health or opioid reduction, whatever it is, and you can have these amazing conversations, whether you're sharing the same opinion or it's different, and it's an educational conversation and you both are learning from each other, which I think is just amazing. Like where in undergrad, you could go to a class and maybe everyone had a different opinion from the teacher, or you didn't have the same opinion as the person next to you and you didn't feel like you could quite share it because you wouldn't learn anything from it. But in this world of grad school and grad classes, where I'm fortunate enough to only have maybe 8 people in a class with me, so it's 8 with 1 professor, the conversations, not even about public health all the time, just about life circumstances, what we saw throughout the week, are just, nothing beats it. Like you're learning, but you're also enjoying it, and it's applicable to everyday life, whether it's your own life or you're going out and going to get a job that changes someone else's.
I think the asset of being in grad school is the flexibility. I mean, I remember like in high school, I did like 8 hours of school every single day on top of extracurriculars, and I was an athlete. So I don't even know how I did that, how I had the stamina of doing it. And then undergrad came and you had a little more free time. You know, you didn't have class every single day. You didn't have classes like one after the other. That gets better even in grad school. Like I think I only have 2 classes per week and I'm still hitting all my required credits I'm supposed to take. So that gives more flexibility in order to branch out and do more of what you thought you might not be interested in. I currently, like, which I'll get in later, but I currently have 4 jobs, and I'm able to maintain all of it with school, as well as like I'm on student government. So, and I'm represent my own department, like as a liaison between students and the faculty and staff, as well as being like an ambassador for my undergrad and for this is public health. So I think the flexibility of being, don't do a lot if you can't handle it, I'm just different, but like the flexibility that you probably wouldn't even imagine, as well as like, I guess for me, like and personally, like leaving my hometown, which is from Florida, and starting a new place was also was something that I really needed. And I share a parking lot with the CDC, so even like having the opportunity of even like meeting and branching out with higher professionals as well has been a great experience.
For me, I would say like as a grad student, we have to be more proactive than we were as undergrad student, and there's not a lot of hand holding. You have to make your own decision. Having said that, our professor would be out there looking for us, but they want us to make our own decision. And also there's so much more opportunity, and I guess like in undergrad, I don't know if you can relate. Me, I come from different education system, and when I came here, I had a hard time transitioning into American education system. So with undergrad, and I was pretty shy to talk to professors and then look out for the like ask them if they are doing some research or anything. So with the grad school and also at East Tennessee State University, the professors out here are so approachable, so nice, and they always, whenever we talk to people, like we talk and ask them like if they have any opportunity for us to work on abstract or manuscript or any research, they will always they always welcome us. The only thing is that you have to be the person to go and look out. No one is going to come and give you all the opportunities. So
Yeah, I think grad school is like such a shift in perspective. I remember having like this conversation during orientation where like someone mentioned like the people here like want to be here, they don't have to be here. And I think that's like that like kind of completely changed like that perspective that you have going into like your MPH, that like people here are here because they're passionate about public health, they want to be here and they want to like practice or pursue public health and like whatever their career trajectories may be. And that honestly has been so rewarding. I know Haley mentioned like her foundations class, and I remember my foundations class last year, like one of my most, like we have discussion labs, like most memorable discussion lab has been like one where we're like planning like, oh, I forgot what it was called. Oh, I forgot the kind of like, it was like a bioterrorism type attack. So we're like planning with health officials, and like I got to be like the US Postal Service. And I was like, it was like so funny to me because I was like, well, I'm mandated by the federal government, and everyone else in my group was like local or county or state officials. I was like, you can't tell me anything to do. Like the order has to come from like the president to like the postmaster general, and then I get to do it. So I was like, I can't do anything. And I was like, I was being a little like not flexible, but I think it was like so fun to be like part of that conversation and be like, wow, like never would have thought that like being part of like planning a prevention to like a bioterrorism attack, like all of these like units, like the health officials, the public health department, the hospitals, the police force, like everyone, and then the postmaster. So I was like, okay, this is so interesting. You don't think about it, but it's things like that that like kind of leave like a memory. Or like we're in Philadelphia, so like we had a walking tour where we got to go and see like the polio outbreaks, and it's so unique. And again, like people want to be here, they want to do, like they want to be able to do these things. And how like Inara said, like over the summer I had 4 jobs, and I was like, even though I didn't have classes over the summer, it was still something like the opportunities came at you and you kind of just don't want to let them go. You're like, I don't really care like if it kind of like hinders my sleep for a couple of months, but if this is something that I have the opportunity to do and like get to learn from, you want to like take them. So I think being part of like grad school, like MPH, has been like so rewarding and so fulfilling.
Grad school is definitely so much fun, and you definitely meet your people, which is awesome. So I know I'm going to pull out and start with Inara for this one, since you mentioned all your jobs that you're working. But I know in grad school, especially, some people are working full-time, some people are working part-time, and some people are just going to grad school and doing other things on the side. So I want to understand how you're managing it now, and then if you're not working now, if you're working in between, if you worked in between undergrad and grad school. And Grace, I'm guessing you probably might sit this one out, but feel free to add if I'm wrong.
Yeah, so time management is key. My planner is my best friend, and I use my calendar daily, like everything. I obviously I won't remember everything that I had to do that week, so I put everything on my calendar. I kind of have a saying where it's like, if you're not on my calendar, I won't know. So like I need to be sent an invite or an invitation, or I'll put it on my calendar somehow, kind of thing. But yeah, like as Michelle was saying, like opportunities get rolled into you and you don't want to say no. And that's kind of, I guess, the situation that I had. So I currently hold all my positions are part-time, and I hold 2 at the School of Medicine at Emory. One is where like for an HIV new injectable drug that they're introducing. And the second one is like a quantitative and qualitative research study about South Asians that currently live in Atlanta, and their cultural aspects combining with like their hypertension or cardiovascular diseases or diabetic metabolic diseases, and how those 2 correlate. As well as I work at the Emory Prevention Research Center. And with that is where I work with people that are not financially secure in Georgia, and they seek help with 211, and kind of like do a quantitative study on kind of the healthy foods that they have or don't have. As well as I'm also a TA in one of the introductory courses of my department. And with that, those are being paid, but I also have other positions that are not being paid, such as being an ambassador, as well as also most on student government. It does get a lot, but I don't add anything unless I know for sure that I can't do it. So a lot of some work is more than others. I wouldn't say I'm working like each one is like 30-hour week, 30, I need dedicate 30 hours for each thing I'm doing. No, no, no. Like in total, I'm capable of doing schoolwork and my jobs and still have a social life. So
I need to just back you, Anara, on that, on the importance of the calendar. I have my Google Calendar, my whiteboard calendar, my paper calendar, and if you look behind me, you'll see this wall of Post-it notes. I've color coordinated Post-it notes for each week in the semester that are assignments. They are work things, research things, even social things, etc., that I can kind of just like pull down as I go throughout the semester, just because it helps keep me organized and also gives me this like sense of accomplishment when it's like one more thing turned in. And as we're getting towards the end of the semester, it's even more important. I was working full time for a year with the Colorado Department of Public Health and the Environment. Unfortunately, though, that was a temp position, only a 9-month contract. And so once it was done, it was done. It was difficult, though, I'm not going to lie, to be working full time while taking like 14 credits. And then I'm also a student ambassador, so I have to give like campus tours and things. And then I'm doing research on top of that. So, but I would say, if you have to make ends meet, you can make it work. Like I am getting straight A's while doing this. Like it hasn't been a detriment to my grades. I wish I didn't have to work, I'll be honest. It'd be great if I could just be all school. But again, as folks have said, the opportunities that come up, you can't turn down. Like anytime a research project that is applicable to my interest comes up, I dig my little claws in because I want that experience. I love doing research, and yeah, it's one more thing, but as long as you have your own system of time management that works for you, I think it's really doable. Like you can, and at the end of the day, you can have a life. I do get to see my friends. Well, like Grace said, every conversation kind of goes towards public health. So it's like, even if I'm with my friend group, we still talk about, injustices in health and how we're going to fix them someday. But it's possible to do, like all of the things, which I never thought that could be the case. But I worked 7 years professionally before I went into grad school. And I think and I'm still so excited to be doing something that I'm more passionate about than that former work, that I've found a way to make it all sort of work. And I also find that graduate school is so different from undergraduate and how the flexibility that exists, or, your teachers understand that you're a human outside of the classroom. You're not just a number. They'll notice if you're like feeling off, like they check in with you. And I think that helps make it possible too, is how supportive the community is. And that might just be public health in general too. It seems public health people just seem to care about folks a lot more than the general public.
I can go next. So, yep, agree with everything. My like Google Calendar, my Outlook calendar, I have like a work calendar. They're all like working together. Like I have like everything like kind of incorporated onto my work calendar. So like after my work meetings are done, like in the evenings, you'll see like all the other stuff that I need to do. But everything's incorporated. It's like color coded, very type A personality here. So you got to make sure that it works out. And like, yeah, still able to have a social life, still able to have fun, still able to like take my me time for myself. Because like mental health is very important, and like making sure you get like the self-care that you need to like go and pursue these things is also very important. So like about like the work that I've done. So at Drexel, I was part of their medical cannabis like research study. So we're looking in Pennsylvania, since medical cannabis is legal and like you can use it with like doctor's prescription. No, I guess we're enrolling patients into our study to see like what the long-term effects of the study are. And it's like really interesting because I help consent people, but that like job itself like does not take a lot of time after you go through like the consent form and kind of enroll people, but you still get to hear their stories and like learn all these things about medical marijuana that like I never knew previously. So it's always like interesting. Like this is a field that I was like never thought that like I would work in or do anything in, but to hear like their stories, to be like, this is the only thing that helps me with my pain. Like there is nothing else. I've tried for years. And I was like, oh, like there's so much more to this that like I probably would have never realized without like learning, without being part of this study. So that's like one of the things that I got involved in, like starting in February. It was a long time getting through the IRB and training, but absolutely love what I do, love meeting those people. But over the summer, I had a chance to be part of like, be a research assistant at like UNC for like their Center for Health, I think disease prevention and like health promotion. So I got to create like this pilot study that looked at like nutrition and like physical activity, like best practices that parents were like implementing in like kids in like their families, like with that had kids diagnosed with like autism, Down syndrome, and that were typically developing. And that was so cool because I was like, I never realized like the importance that people place on like nutrition. Like we had conversations that would go for hours that like debated the difference between breastfeeding and infant feeding and like what kinds of questions are appropriate. And I was like, oh, I did not realize that like this required an hour-long meeting, but one question would require an hour-long meeting. So it was really nice to like kind of like create a study, like start with it, like do like the coding for like creating that survey and like the analysis. And we're still working towards getting a publication because it's going to create like a practice, like a grant application that like would be useful for parents that don't have access to these resources like long term. I got to work on like implementation plan for like the Children's Hospital of Philadelphia, which is like one of like the biggest children's hospital in the country. And that was so cool. Again, unpaid thing, but I got to meet with like so many like different people in like a hospital setting that are all doing like work in public health that you don't really realize that like there's so many opportunities. Like if you're looking at like opioid prevention and then you're like physical activity and wellness, like completely different things, but they're like targeted all towards like the well-being of kids and infants and like the population that like it's called CHOP, which is weird, but that CHOP serves. And then last thing I did was also I was a field researcher for like the Urban Health Collaborative at Drexel over the summer. So I got to go out and like into the field and kind of like do like interviews with like people in communities of like these various like play spaces that had been created by like the William Penn Foundation. And the communities that they're in. So you want to see like how people are utilizing these spaces. So we would be there for like 3-hour chunk times, like in the day, just sitting there. If there's people, we observe, ask questions. If not, like we're just chilling there for 3 hours. So it's like definitely like a unique experience. And through that experience, I got a chance to go into Kensington, which is like one of like the biggest opioid crisis locations in Philadelphia. And that was like a whole unique experience because I remember learning about like the opioid crisis during like my foundations class. And I was like, okay, cool. Like I get it's a problem, but seeing it firsthand, like you get off that train station and there are people who have like needles in their hands, you see blood, like they're like, and for people who like are like don't like have a needle phobia, like definitely would not recommend. But like that was such like an eye-opening experience that like from where I live, like 30 minutes by train, like this is going on, like this is in the city that I live in. And that got me like, I was like so much more motivated after that to be like, hey, like I want to do something, I want to work with this population and help them. So I recently just got a job and actually I work with that population where I go into that field and I'm looking at I'm like helping out with like mental health and looking like doing a project I'm like a project evaluator for like a grant that the company has gotten from SAMHSA, which looks at like kind of integrating a model of care for people who suffer with mental illness and like substance use and misuse. So definitely so many things, but you can do so much. And like again, like if you're passionate about it, like highly encourage you to try and do everything if you can.
I can follow up that, but first shout out to CHOP, love CHOP. I'm from outside of Philly, so anything with them is amazing. But I do have a job, so student athlete, grad student employee. The thing that ties it all together is that calendar that we've talked about. So having Outlook, Google, and Team Calendar all syncing together, starting from very early in the morning until all the way up to that last class that ends at 8:30 at night, where it's all there, and that's what keeps me going. But kind of as we started off with Anara saying, if it's not in my calendar, it's probably not going to get done. If I don't have that little 15-minute reminder prior to when it's supposed to start or be turned in, I'm not going to see it. I need that little kind of like, hey, this is due, or you're supposed to meet with this professor. But no, so I'm currently working with my university's Department of Wellness and overseeing those peer health educators and our student advisory council, as well as helping and partnering with our university counseling, our telehealth, nutritionists, physical therapists, anybody in our health center resources, and just kind of being a liaison between students in our body. So around 16,000 students, and then to those in the professional suites on our campus that help with health, well-being, all of the dimensions of wellness, just really caring for the student population that I think we've all kind of seen take a big hit after COVID, and they're all developing, and they're a much different population than what we were seeing 3 years ago. So being able to adjust for them and their needs, and really being able to communicate that to professors and anybody else that is seeing them as well.
For me, I would say like time management did not come natural to me. I struggled through it because when I was in Nepal, we only had 3 exams in a year, so we didn't even have weekly assignments to do. So I didn't have to worry about all those assignments much. I just studied for 2 days, for like 2 to 3 days for my final exam, and it was not that difficult to pass that. So when I came in here, and then we had this weekly assignments, on top of that, you have to do volunteer work in public health, and you go to different places to get credit hours, extra credits, and all stuff. So now, after living here for like 8 years, I have learned that I'm not an expert yet, still working on it. So I put that down in my whiteboard and on my Google Calendar. Like I think whenever the semester starts, that's when we need to know like what class has their assignments due on what day. So it would be same for the whole semester. So we don't have to worry much about that, except from the exams and all the stuff. I am a secretary for Graduate Professional Student Association, where we help graduate students to successfully graduate, because we had a lot of dropout rate, and we help them academically and professionally, and also encourage them to be part of all this conference, provide them $600 travel grant. So that is, we have event every week for that program, and I don't have to worry about my finances much, because my graduate assistantship pays for that. So I work for the clinic for 20 hours, which is not much, I would say, where I'm also getting an experience as a social media marketer and helping a radiographer with all the scheduling and all the stuff. And that is what I will be doing when I graduate with my degree. But I think the hardest part this semester has been applying for job. That is a full-time job, finding out what you're interested in, and then all this administrative residency, administrative fellowship, they require you to write a personal statement, 3 recommendation letter. So you have to reach out to people you work for, hear back from them, and all this stuff. So, but that kept me very busy for first from August to almost October. October 7 was the last day. But other than that, I think Google Calendar is the best. But I don't think I can work like in 4 different jobs. I'm not that. I'll be overwhelmed very easily.
Don't know how you all do all of that either here, but I definitely was taking some notes and ideas, because my time management could also use some help. It does not come naturally for me either. So I have 2 questions left. So I want to also remind the audience, if you have any questions that you want to drop into the chat, feel free. But for now, let's talk about applying to grad school again. Do you have any advice on getting through the application process? I know it can feel daunting and overwhelming. especially when you're facing with your statement of purpose. So how did you manage all of that, or what advice do you have?
My best advice is to utilize your campus writing center if you have one. They are amazing. They're there for you. And like, they were so helpful writing my statement of purpose, because I think that's the most daunting task of your application. You're like, how do I talk about myself, which can be really uncomfortable? How do I hype myself without sounding like, like I'm full of myself? And how do I make sure I hit all the right notes? And I just recently worked with them on my statement for PhD programs. And it was really great because they will walk you through step by step. They'll ask you questions that, are tailored to the specific questions for the specific schools. And I thought that was so incredibly helpful. It was something I had not utilized in the past, and I wish I would have. They're really great. Other advice I'd have is don't let any perceived limitations that you think you have stop you. I'm a first generation student. My parents, they didn't even go to undergrad. And so not only was undergrad a lot of mysterious new experiences for me, like what is a bursar's office, but grad school too. I was like, well, how does this work? Don't let any of that limit you. If you are passionate about the field and, you can express that, the schools are going to take you in. They're excited to have you, just like you're excited to go there. So those are my two big recommendations. Utilize your school's writing center, and don't limit yourself just because you think that, you can't do anything, because you can pretty much do anything if you put your mind to it.
Mine would say, so you can reach out to your friends and families to proofread your SOP, because I drafted 4 SOP before submitting it to a school, and the first one I was like pretty sure that would be the only one I would write, but then when I sent out to my brother, like his best and worst critic, I would say, and he said that he did not expect how it is. Like he expected more from me because I've been living here for a while. So having different eye would help you like make it. It's not like it's bad. It's just like you have to make it narrow it down, and then make it sound more convincing, I would say, because there are so many people applying, and yes, they are willing to take you, but also they only have so much quotas for people, especially if you're applying for a graduate assistantship, so that you don't have to worry about finances. And the other would be, do your own research for your school. What is best for your friend will not be best for you. Look for what research they are doing. Look for the opportunity out there. If there are student association in public health, how involved is school with everything that's going around, because there are so many universities in US. So you have to figure out what you are interested in, and then align that with the school, and I think that will get you in.
For me, I think it's a little different doing the 5-year joint program. My professors were my biggest resource and cheerleaders, like asset I could have ever hoped for. So just having conversations with them, like if you're just not sure what you want to do, and if grad school seems like this really big daunting task, your professors are there to cheer you on and be like, you're going to be able to do it. I've seen you in the classroom, and you have all of us behind you supporting you through the application process, or just to chat to because you feel like you're in a rut and you can't do it anymore. So leaning on the people who you already know through your undergrad classes is just a great resource.
I would say start early. I remember I knew I was going to apply to graduate school, so I started writing my personal statement the summer before I applied. So I had time for either my friends who are already in graduate school, or professors to proofread my personal statement, or if you know the supplemental essay topics, those as well. I would also say give yourself some grace. It's a very tough moment to be in when applying for application processes, and I understand failure is a thing, and you have to fail in order to succeed. So it's okay if you don't get into the very first school that you apply to. It will all work out at the end of it. So yeah, so keep your head up high, be positive, because this is, I understand, it's a very serious and very overwhelming time period, but it's all worth it at the end.
All great recommendations. One of the biggest things for me is that I grew up in Minnesota. So it was definitely something I was like, I'm ready to leave. I'm ready to venture on my own. So do your research, like explore, like there's so many schools with so many different public health programs. Like some have same concentration, some don't, some have like unique experiences, like in terms of like the practical learning you have to do, in terms of like the final thesis or project you have to do. Like some, like Drexel has minors, like so different from each other. Look at like where they're located, look at the city, like what is the city like calling out to you? Like if there are certain population groups that you're interested in, certain health inequities, like maybe that's the city that you want to go into. Like look at financial aid, look at tuition, do all of that research and like start early. Like again, there's so many that like it's overwhelming. And when you go on SOPAS, like they like all of their like deadlines are different, which is like very annoying. Like when I started applying, I was like, okay, cool. So one's due like 2 months before the other is due. So starting early, like knowing when the deadlines are, so you're well prepared. But yeah, like utilize, like write your personal statement. Like I didn't go through this, but I did like edit my friends like this past year, and she went through 18 drafts for a personal statement. It was not through like public health school, but still 18 drafts. And I was like very annoyed by the end of it, but like the difference that you see from like the beginning to the end is like very like it's like so different. And like in your personal statements, like be you, like truly like show who you are, like even if it's like the little bad things, like or like how like if there is no adversity, like why are you passionate about like public health? And it doesn't have to be like public health as a whole. You can talk about one specific thing. If you want to look at like social determinants, well, social determinants are huge in itself, but if you want to look at one like specific thing, if you're looking like mental health, talk about that. Like why are you so passionate about it? And I think it will come through. And I like a big point that comes across. I remember in like my first year like biostatistics class, it was like after our first exam. So it was like our first exam of like our graduate career, and our professor saying to us, like he's like, you know, like regardless of what grade you got in that exam, like you are here because like we believe that you are able to succeed in your program. Like you are not going to be here like if we didn't think you would succeed. So go in like with that like motivation that like you will succeed in like what you are trying to do, and like you will like reach your like career goals and aspirations. And I think it will make that process like a whole lot more enjoyable than being like it's another task that I have to do.
All fantastic advice. Definitely helpful as you're approaching the application process. So the last question I have for you all tonight is just more general advice. So thinking about your younger self, what advice would you give to a prospective student who is thinking about studying public health or a career in public health? What would you wish you would have known, or what would you tell them?
I can go first. So for the people, like for the for prospective students, I would say public health is something you have to be passionate about. Just because someone you know did it, you should not go and jump in and enroll in public health. It takes a lot of emotion, and you don't get a result right after like any other jobs. It takes years. Sometimes you'll never get to see the result, and you have to change from what you're doing to different thing. So it will be very overwhelming at times, but that's where you have to learn to put your emotions aside. And I also think that as a woman, we have to be strong, and then also learn to say no to so many things that comes to our place. And then it is already a struggle that we have to prove ourselves in so many leadership roles. So being assertive and then saying and believing in what you say and doing in what you believe will take you to whatever you dream for.
I think for public health, you need to be passionate and driven, but you also have to be patient and flexible. Like there's a lot of times where things are not going to go your way, and you have to hold true to who you are and what you're believing in and why you're here in this role. And also, like coming into it, I didn't know what my interests were in public health. Like I just knew I wanted to help community level. And so I took time and just ventured in different areas, and I found that I really liked maternal health and then the opioid crisis. Like you have to work through and look at all these opportunities and be patient with what's in front of you until you find what that little like niche thing is that you want to do, but then hold true to who you are too. I think it's very important.
I would say be open-minded. I mean, public health might be broader than you think, and you might find different interests that you didn't think you liked but earlier when you first entered the school. That's why they have certificate programs probably at the university you might end up at, and that's exactly what I did. Some programs for certificate programs are kind of, you can apply with while you're in school rather than before while you're applying for your graduate program. But I would say like keep an open mind. You might go in thinking that you know exactly what you want to do with public health, but that can change.
I would say to prepare to advocate for yourself and for the field. We've all picked a very interesting time to go into public health. And, not everyone believes or understands what we do. And I think a lot of that, not believing in what we do comes from a lack of understanding. And for our part, that just takes patience and explaining to people like, this is why public health is important, and this is why we do what we do. And just knowing that that's going to probably be a little bit of your life, at least, is explaining the importance of public health. But I've also found that people who were resistant or hesitant about public health, when you sit down and listen to their, what their concerns are, and then you explain back to them like why their concerns are valid and the great work that we do, they're very, very quick to come on board with the mission of public health.
One of the biggest things I've learned over the past year and a half, I guess, about public health has been that it's like a give and take field. It's not something where you're just like, all right, like I want to do something and it's going to happen. Like people mentioned, it's going to take time. As an epi student, like I don't understand policy, like I just can't. And it's very hard for me to understand like how like the data, like you research, and like then it has to go to like a whole different like environment and field. Like it has to be made like understandable by like policy experts and policy people, and that's a completely different field and group of people that you're going to be working with. So like while you're all passionate about public health, you're going to come across like people who approach situations and topics, even though like your end goal is the same, like they're going to approach these conversations like you want to achieve the same thing in different ways, and you have to be flexible. You have to be able to like communicate, and I think that's so important. And like one of the biggest things, so I think last week I had the chance to like plan like an MCH related career panel, and one of the panelists on there, so she like did her like she's doing her like MD MBA like dual degree after doing her MPH, and she's like, how did you like maintain like your like passion for like maternal health, like how is it consistent? And it's like you have to be repetitive. Like with public health, sometimes we're trying to change human behavior, and that is one of the hardest things that you can ever do in life, to change someone's beliefs and understanding of ways things should be done for like the benefit of like the collective population. But like to like, if you're passionate about something, stick to it and keep sticking to it no matter like what types of adversity comes in your way, because even though it's years or however long you may not see it in your lifetime, it will happen. Like people will realize. So be like accepting of how that give and take relationship works, but also like pursue what you want done, and like the policies that and like research that you want done to like make public health beneficial for everyone.
Amazing advice. I have had so much fun listening to y'all, and I could keep talking to you and hearing your stories for the next few hours, but it's, you know, it's coming up to be time. I'm not seeing any questions in the chat, so I'm going to say thank you all and pause the recording, but I really appreciate your time and your willingness to share your passions with students. Like I said, this has been really fun and really interesting. So I hope you all enjoyed it. But thank you again. So have a great night.
Thank